I only can imagine the number of patients and patient lives that are going to be enhanced and saved and improved as a result of what's going on here tonight and what's going to come out of this accelerator in this cohort that you'll hear more about, and then future cohorts as we go forward.
You may be surprised, but 80% of the drug that's inhaled doesn't even make it into the lung. It's going to the throat. And in the throat, it leads to local and systemic side effects. Less than 20% of that medication that's on the label actually makes it into the lung, and a very small amount of that makes it into the small airways where the vast majority of inflammation occurs. So we're going to solve this problem by delivering drugs with high efficiency into the lung, and we've overcome these challenges, especially delivering into the small airways. This is a well-known problem in aerosol medicine. Many have tried to reduce the particle sizes, but that alone does not solve the problem. You have to get the particles deep, but they also have to stay there. So that's what we do. We start them small. We use the resident lung conditions. We grow the particles for optimal size for deposit, and we have a high efficiency of delivery.
So what we are offering is improved filling, which results in better packing density, less compaction, which means fewer retreats, a lower cost to the providers, to the physicians, and to the system in general when you're looking at platinum coiling versus a polymeric coiling, and improve outcomes. That is our main goal in doing this, is to reduce that 1 in 4 to maybe initially 1 in 15 or 1 in 10 if we're lucky. But the key is really improving the outcomes for the patients so they don't have to get brought back into the hospital in order to be retreated, because you have to go through the same procedure, run the same risks once you're put into the fluoro lab and they put up catheters into your brain.
Now, we all know that snoring is a significant social issue. It causes a lot of strife between friends, families, and particularly spouses. And 35% of adults snore, and that only goes up with age. So about 50% will snore by the age of 50. So we all have that to look forward to. And we all spend a lot of money on anti-snoring devices, about $1 billion every year to treat this problem. Unfortunately, though, the solutions out there are bulky and uncomfortable devices. So a mandible device that pulls your jaw forward, a CPAP machine that's just bulky and uncomfortable, or adhesive strips that you put on your face. Well, Soundly is different. We are a therapy that you do on your smartphone during the day so that you can sleep snore-free and device-free at night.
We're focusing on two major issues of the heart. The first one has all to do about timing and heartbeats, cardiac arrhythmias. The second one is heart failure, recognized as a major epidemic in the United States and focuses on the pumping ability and blood flow in a heart. Together, these represent about 500,000 patients that need devices a year in the US alone. But current solutions are not providing what the treatment needs, and it's a lot of the same old that has resulted in increased complications and cases where the treatment has been ineffective in up to 30% of the cases. And the same old is also resulting in too much implanted hardware. So our solution focuses on making novel use of the heart's anatomy by creating one universal lead that can be applied for all the different pacing solutions.
FDA-approved site locations are stomachs and arms. So you could imagine that these are very visible, especially in the summer and for athletes. And we see this causing significant depression and social anxieties, especially in kids. So what Expression Med does to try to solve all of these problems at once is we have one tape that can be applied without any glues or other materials to the device, and it doesn't require any extra cutting. And then because it is so thin and high tack, you can scratch it with your nails when it's on you and it won't lift up. But then when you remove it and stretch it like a command strip, it will leave no residue or skin trauma.
So Vitros Health is a efficient alternative to the in-person clinic visit, and we create a direct-to-consumer testing solution that screens for the most common ailments before you even have to go into the clinic. So we use 3 different types of specimens to screen out these most common ailments, give you a result, and so we try to save money and time in the process, and this is how the system works.
So let's say you're feeling a little sick and want to know what's going on before it gets too serious. You'd be able to walk into your local CVS or Walgreens and pick up one of 3 kits. The throat kit, blood, or urine kit. And which kit you pick up is based on a symptom assessment that you take online before you even walk into your CVS. So you take that kit, buy it, take it home, deposit the sample, and with a prepaid shipping label, send it off to your local diagnostic lab. That lab will conduct the tests and send us, the Vitros, the results that we'd be able to show to you.